We have overwhelmed success, and we have requests from all over the world, including governments, not only private agencies and friends. And so when it's G to G, government to government, it's easier. And therefore, I think I will be able to launch phase 2 and phase 3 very fast. Usually it takes a lot of time and a lot of money, but if we have support over the world, then it will be faster and easier. I just want to say I'm very enthusiastic about the results. It is amazing from physicians to have an idea that a drug can help people, and then to do it in a tube in vitro, and then to give it to animals and to see that it is working, and then to give it to people and to see that it's safe, and also it looks effective. Having said that, one must remember that we have to be very conservative. Everyone should be very modest, and we keep it quiet. We have completed this phase 1b/2a, which helped me, first of all, to say that the drug is safe. The drug is safe, and we have now already almost 150 days of follow-up, so it is safe. It also gives us the hope that it's also going to be effective, but a drug can be effective only when it is compared to placebo. And this is what we would like to do now.
In phase 2. Okay, so if everything goes smoothly, phase 2, phase 3, when could we expect to have this miracle medicine on the market?
I think we can have it even toward the end of this year. It's going to be, we can do it. The beauty of it is that it is easy to produce. We can produce it easily, rapidly, effectively, efficiently, and also at a low cost. So this is good because then it can be within a couple of months, we can supply the entire needs of the world. Again, if we have help and support of government, then it makes things much easier because government resources are much more than the private one or the academia one. So we are optimistic.
When you say it will be, it is not going to cost much, what exactly do you mean? Do you have a price in mind approximately? Would anyone be able to afford it with more or less than the classical vaccine?
Yes, I think so. Yeah, I think it's, I don't know. We didn't go into calculations. It all depends on the demand and supply. So obviously, the more you produce, the cheaper it is. But I think it should be, I'm a socialist, and I think it should be affordable to everyone. I think rich countries should pay more, poor countries should pay less, and it's also for the interest of the rich countries. But definitely that it should be available for everyone. And also I'm not against vaccination. I'm very much supportive of vaccination. I think it should go along vaccinations, and the drug should get along together, and then should be provide us a full answer for everyone.
Could you please give us some details about phase 1 of trials, clinical trials? Because I read that 29 out of 30 patients that had COVID and had severe and medium symptoms recovered within 3 to 5 days. Can you be more specific? How exactly the treatment went, and how did they respond after the first dose, the second dose? What improvements did you see? So we can understand how this miracle drug works.
Again, so I understand, but I just want to clarify. Phase 1, it means first in humans. What you really would like to know that it's not toxic. Primum non nocere, I still remember it from medical school. First, we should not cause any harm. So it was the most important part of this phase 1. It was pleasant to see that the response of the patients, what they told me. So we saw some objective improvement, like they stopped to breathe heavily, oxygen saturation increase, the levels of inflammatory markers in the blood decrease. But the most important one was that they said, oh, we can breathe again. We feel that it was like drowning, so we came back to know we can walk, we can speak. So there were severe patients, not that severe patient that needed intubation. So this is too late. Our drug is severe, but not very severe, in order to prevent the deterioration. But I guess after 1 to 2 doses, all of a sudden we can breathe better. After 3 days, I feel that they are coming back to track. and most of them went home after 3 to 5 days. There's still one patient who is still hospitalized, but not because of the COVID, because they were severe patient with a lot of background diseases, so he's now being treated for another disease, another condition.
So, Professor Arbel, I think it's important to say that this medicine does not have any side effects. Is that correct?
Yes, so far we didn't see any side, even the slight one, no side effect. It's also very simple. The way I can show you. This is what we gave to the patient. You know, this is a wire. We just hook it. 1 minute. Put it here. We put the drug inside, and we give it by inhalations by mask or a mouthpiece, 2 to 3 minutes. And this is the drug. You can see it here. Very simple, very small. In the future, I would like you to have it like everyone can do it at home. So you don't have to come to hospitals. So in Israel, the medical system is very good, but not all over the world. So the way I see it, in first, you don't need a hospital. You can even do it in a community facility and then at home. So
you said 2 to 3 minutes? Is that all? 2 to 3
that's all.
minutes?
It's
Wow.
it's go directly to them. Yeah, that's very impressive. And
Wow,
everything should be simple. If it's not simple, it is not going to work.
How long have you worked on developing this medicine?
You know, I've been working on this concept for the last 20 years since I came back for my postdoc in the United States. And I'm working on this gene that his name is CD24, which has many roles in our body, but one of the main is to be a negative regulator of the immune system. And this is the issue in the COVID-19, which exists only for a year, but I was preparing for it for the last 2 decades. So it is overreactions of the immune system in the lung. So this is a burning area. So we also have been working in the last 5 years on the new things in medicine, in drugs. It's amazing. It's called exosomes. You don't have to be frightened from the name. Exosome means small vesicles that are derived from the membrane of the cell, and they're in charge for cell-to-cell communications. It's amazing. The cells in our body, in each one of us, talk to each other, exchange information for this exosome. So in my lab, we know how to isolate this exosome, to concentrate them, and to cause to overexpress the CD24 that suppress the immune system. And we also have experience in animal models of inhalation. So then we combine everything, now give it to patient, it is working. So from idea to a human, first in human, it took us 6 months. Never described before. At the same time, it's based on 2 decades of hard work. So it depends how you look on it.
Does this medicine work also with the other variants of COVID? Did you have patients infected with?
That's the beauty. It's a platform. It's not antiviral medications. It's causing what the virus causes, the overreactions in our lung of the immune system, and then in all of the body. So if you target it early, I believe in prevention, not treatment, prevention. This is where we prevent. This is the best therapy.
So basically what you're saying is that even if I'm healthy, if I'm using this medicine, it can prevent that I get the...
So the criteria is very clear. You know, the COVID-19 has 2 phases. The first phase is like a viral infections, like influenza, does not need any treatment, but just symptomatic treatment. In 5, 6, 7% of the populations, after 5 to 7 days, there is rapid deterioration, especially with those people with high risk. But recently we see a lot of patients that in low risk, a lot of youngsters. It changed the pandemic, and now we see much more young people. And this is when somebody started to breathe heavily, oxygen saturation is going down, this is the time to intervene. And this is what we are doing. So not everyone, most of people does not need it. And I believe that medication should be taken only when it is needed. even if it's very safe like our drug.
After this amazing news about this medicine, I know Prime Minister Netanyahu reached out to you. Were there other governments that tried to maybe strike a deal with you to buy this medicine?
We're receiving requests from all over the world, 5 continents, but again, I would like to emphasize, and this is what we are doing to now. We have time launching phase 2 and phase 3 studies. So I'll be happy to put on board any country that is willing to do. I'm happy because it has to be proven in every country. And also the tech transfer is easy. We can do it in every country. It can be done. Like in beginning of our talk and interview. It should be available to everyone on Earth.